Hi, this is Klay Solomon, and I'll be presenting my Gait development presentation for lifelong motor development. This first video focuses on a young child who has just learned how to walk, and some abnormalities that I found from this child was just that he walks bow-legged and that he's like toed out. And this just means that his legs are a little bit more turned out and wider, and this widens his base of support in order to increase the stability. However, the opposite of that is that the increased stability actually hurts his mobility, and that's why you see the awkwardness or how it is not very fluid in his steps. And then two constraints that I found for this child was body awareness, since he is not fully aware of his body in terms of how to control it fully and just the size of it and how to operate with it. And sometimes he has a lot of awkward movements that are hopefully going to get better as he continues to mature and just get older. And then also significant others is another one. That's more of a perceptive constraint, just because he's affected by the encouragement by the people that are around him, encouraging him to come, that are cheering him on to keep taking those steps, and without them he probably wouldn't be taking those steps right now. Some theories and principles that go with this young child's gait just shows the main one that I talked about earlier was the more stability needed, the less mobility afforded, found in our textbook. And this is true just in any part of movement. The more that we have a joint or something that is stable, the less mobile it usually is, and vice versa. The more mobility, the less stable it is. A good example of this is the shoulder has a lot of mobility. However, the stability, it's one of the most injured parts of the body just because there is less stability. However, this child sees the reverse of that. Since he is widening his base of support, he has less mobility, and that's why his steps are less fluid, which just causes a more jagged walk. But obviously, it's going to get better as he becomes more of an experienced walker. And then also based on the motor milestones, 9 to 17 months is when individuals should be able to walk alone. This is just a milestone that's pretty average for kids, and I believe that this child does show that he is within that range. So I don't think that he is neither developing super fast or slowly. I think he's right in the sweet spot, which is a good spot to be. And then finally, this correlates heavily with the early characteristics of walking. That's just because his arms are in high guard because he needs to have them higher for more balance. His steps are wide for increased stability. He has a minimal leg and hip extension because his steps are so short, and minimal trunk rotation. That's just because he's a very rigid walker. But as I said, this will just get better as he matures. This next individual that we're going to be looking at is also in childhood, just slightly older than the last child that we looked at. So just some quick little theories and principles into this little girl's gait is that she has short, choppy steps in order to increase stability, and this increases stability because the shorter strides allow her to put her foot back on the floor, so that she is able to regain balance and just keep that steady pace. And as you get older, hopefully those steps are able to lengthen just as we get more balance. But these short, choppy steps are also seen in the elderly on the back end of life when we start to lose our balance and cognitive skills and motor skills. We begin to take these short, choppy steps as well to increase stability. So that's just something I saw as like a little comparison between the two. And she also shows slightly more proficient of a walking pattern compared to the last child that we watched that was in early childhood. Um, Her base of support is narrowed a little bit, which shows that she does have more um, stability than the little boy that we just watched. And her stride length is longer, and she also has incorporated oppositional arm swing, which are signs of proficient walking. It still needs to mature, obviously. However, compared to the last one, it definitely has um, grown and been shown to become better. So continuing on with this little girl and her gait in terms of abnormalities and constraints, the main abnormality that I saw with her was that she's a toe walker, meaning that she's constantly in plantar flexion, walking around on the balls of her feet. And the problem with this is that while she's walking like this, she's constantly missing the first half of the stance phases of gait. So there's no heel first contact or initial contact, and this also plays into her constraints that she has. The one of the main constraints that I saw in terms of the perceptual ones was significant others in social situation. This is just because she also is being encouraged by family members or whoever's in the room with her to keep playing and moving around and having fun. And she probably wouldn't be moving as much if she wasn't, as well as the other big one was a social situation because she is playing a game or playing with toys, as you can see as a picture on the right. And these are two big things that our textbook talks about a lot, just how important that these constraints can be in terms of either inhibiting or promoting actions. And then the physical constraint would be calf muscle tightness because she is a toe walker. Her calf muscles that are composed of both her gastrocnemius and her soleus are going to be very tight, which is going to promote her to be in this position even more. Because since they're tight, they're going to like being up on her toes since they're shorter and they're not elongating like they should be. This next individual that we'll be talking about is like an individual that is in adulthood. And so some theories and principles into his gait is that he exemplifies proficient gait according to our textbook found on page 129. He has equivalent stride length that are equal on both feet, but it's also a good distance. He's really good at having heel and then forefoot in the initial contact and the loading responses for gait. He has a narrow base because he has good balance. His knees lock for stability. He has pelvic rotation, and he has oppositional arm swing. These all exemplify proficient gait, and it's very evident in his walk. He goes through all the proper phases of gait, and he has about a 60 to 40 stance to swing cycle ratio, which, according to Dr. Perry, in his article, was a very good and very normal range, and so he qualifies that, which then qualifies him as being an adult with proficient gait. Along with his adult's gait, there also do come slight abnormalities and constraints. Some just slight abnormalities that I saw were that he was slightly toed out with slight eversion in his planting foot. Also, he has minimal trunk rotation compared to what it needs to be, and he also has minimal pelvic rotation. None of these are extreme, they are still present. They just aren't necessarily as well of in range as they need to be. And the same thing with the toed out and slight eversion. It's nothing completely terrible. It's just something slight that I noticed that could be corrected, but a lot of it probably is just pathological and it's going to just stay there for the rest of his life. So constraints that could be from that, I thought a good physical constraint would be pain that he could have or past injury. Seeing that he is in swimming attire and like seems to be by a poolside, I'm assuming that he's an athlete. And so potentially having a past injury, or maybe he does have pain, so walking with a little bit less of movement, or maybe walking toed out helps him, or maybe it's just from his sport life. He's just used to carrying his body in that manner. And then also a perceptual constraint would be just the fear of injury or re-injury if he has been injured before. So that fear is also going to make people walk differently, or not that they're always consciously thinking about it, but they could subconsciously be moving their body in a way that they feel that they're avoiding injury. Continuing on in the presentation, we move on to older adulthood where we see a more elderly woman to the right walking. So just abnormalities that I saw within her gait is that she has very common elderly gait as described in our textbook. She has constant hip and knee flexion throughout her gait. Her ankle is limited in extension. Her shoulders are rounded, which then puts her trunk in flexion. She also has reduced stride length, like we saw in some of the younger children. And she also has reduced balance, and that's because of the small steps. All these abnormalities are pretty normal in elderly, but it is definitely evident in her gait as she shuffles along the floor. And some constraints that come with that. One of the perceptual constraints that I came up with was just that she may have the fear of falling, just because knowing that she's elderly and maybe more frail, the thought of falling is kind of daunting and scary, that it can cause a lot of pain and a lot of injury that could last for a long time. So because of that, they often will begin to take smaller steps along with other bodily deterioration. But then the other constraint that I came up with was bodily pain. When you come to older adulthood, there usually is a lot of pain with gait. Um, And so this can cause her also to walk the way that she walks, so she doesn't have to pick up her feet as much or different things like that if she does have a hip or a knee or some sort of joint that is hurting. And finally, moving on to theories and principles of this older adulthood gait. I thought that Newton's three laws were really huge and they all take effect here in this phase. Especially with the first one, that an object at rest wants to stay at rest until an outside force acts upon it. And when this elderly lady is at rest and getting ready to move, you can see that she takes her a minute to get up because her lack of strength and different things like that. It still takes the same amount of strength to get up. However, she isn't as strong. So it's really hard for her to get up out of that. And then with the second law, it's kind of a similar thing with the force, production, acceleration, and mass. All of these things need strength, and they're all related both inversely and directly, depending on which way you're looking at. But then again, also due to her deconditioning, it's a lot harder for her to get moving and stay moving and move at a consistent rate as you see her shuffling across the floor. And then also with Newton's third law, to every action, there's an opposite and equal reaction. Even though she is older and different things like that, the floor is still pushing up against her in the same way that it always has. And since she is, again, not as strong and deconditioned, it actually takes a lot of her energy to move across the floor, which then is a big reason why she probably doesn't pick up her feet as much and kind of slides across the floor. So yeah, so just a big thing I wrote about that was just due to her deconditioning. Since she has reduced strength and balance, it's a lot more harder to produce the necessary force to continue moving. Um, and so this is just a very common thing to see. I do not believe that she is an outlier in this in terms of an old person in older adulthood. Um, and then the other principle that I fell across was that she has antalgic gait symptoms. This is a lot of times when it's hard for people to want to pick up their feet necessarily. This is super common in the elderly. And I saw that from Muyon. She wrote about Dr. Muyon wrote about this a lot in her article as she studied elderly people. And it's very common in elderly people. So once again, I don't believe that she's necessarily an outlier. However, it is something that is going to affect her in her day-to-day life and mobility. So this wraps up my presentation. Thank you so much for listening. And then here's just a slide with all my references that are cited throughout. Here's just the formal reference page regarding those different sources. Thank you.